So what TAILORx told us that there are many women who have low oncotype risk recurrence scores who do very well. So that was the first thing it told us. But the latest presentation told us that it was indeed okay not to offer chemotherapy to every patient, that every patient does not necessarily benefit from chemotherapy. I'm sort of very proud of oncologists because we really want to give the right therapy to the right patient at the right time and don't want to have too much or too little, just right. So those patients who can avoid chemotherapy, I thought was very important. The surprising finding to me was about patients under the age of 50. So for the young patients, maybe they can't avoid chemotherapy even with a relatively low oncotype recurrence score. So I was sitting in the audience and one of my partners is texting, "Isn't this amazing?" And I'm thinking to myself, no, this is what I've been doing on the clinical trial, and this is the data I've been waiting for. So very helpful to be very precise in terms of who needs therapy, who doesn't need therapy, and how I can advise my patient. I had a patient waiting for the results of this trial when I got back from Chicago. So, and I was able to discuss with her the need or the fact that she could avoid chemotherapy. So I was very happy with that.
Sure, and that leads to a higher quality of life.
Well,
obviously.
If I give you something that's not going to help you, I can only hurt you, right? So the quality of life is very important. We're talking about, I used to give chemotherapy to 100 patients to help 10. I give chemotherapy to 60 to 70% fewer patients to help 10. So I'm helping a much higher percentage of the patients with my chemotherapy, and I'm not giving chemotherapy to women who can safely avoid it. And it's a wonderful thing to be able to do.